Good morning, everyone. I'm welcome to panel 7 of our conference on population aging. And we are this morning in panel 7. I'm Christine Wong. I'm at the East Asian Institute in NUS. And we're very happy to welcome a distinguished panel this morning. And I'm going to introduce them. First up, we will have Professor Zuo Xuejin, who is professor from the Shanghai Academy of Social Sciences. He received a PhD in economics from University of Pittsburgh and spent a postdoctoral year at Princeton University and also spent a year at the US Bureau of Census as a visiting fellow before returning to China in 1991. I know Professor Zuo from when he was vice president and executive vice president and acting president of Shanghai Academy of Social Sciences. He held these positions during 1994 to 2012. And after that, he was director of the Institute of Economics at the Shanghai Academy during contemporaneously, he was director during 2000 to 2013. And he has been working on research on China's population economics, focusing especially on Social Security reform, China's Social Security program, urban and regional development studies. He's led the key research project, the Economic Features and Supporting System of an Aging Society, sponsored by the National Natural Science Foundation of China. He is also president of Shanghai Association of Gerontology, and he's on the board of directors of the China Association of Gerontology and Geriatrics, China Health Insurance Research Association, and China Association of Labor Economics. Very happy to see Xuejin here this morning. I'm going to turn the floor over to him soon, but let me introduce all the panelists all at once now. Next, after Xuejin, will be Dr. Elena Glinskaya. I think you saw her in the panel last night. She was chairing that panel. Elena is lead economist at the Social Protection and Jobs Global Practice at the World Bank. Dr. Glinskaya joined the World Bank in 1999 and has worked on a wide range of bank products, including development policy and investment loans, sector assessments and technical assistance in South Asia, Europe, Central Asia, and East Asia regions. She's published books and articles in the areas of social safety nets, health, migration, poverty, labor markets, and aged care. Between 2012 and 2018, Elena worked and lived in Beijing, where she led the World Bank Dialogue on Elderly Care. Dr. Glinskaya received her MS in Math and Computer Science from Moscow State University. And she has a PhD in Economics from University of North Carolina at Chapel Hill. And then the third paper will be presented by Dr. Li Yao. Li Yao is currently a research fellow at the East Asian Institute, my colleague. Before joining EAI, she served as tenured associate professor at the University of Electronic Science and Technology of China from 2011 to 2019. She received her PhD in economics from the University of Hawaii, where she was also a degree fellow of the East-West Center. Li Yao has published papers in World Economy, Review of Development Economics, Energy Policy, Journal of Asian Economics, and so on. Her ongoing research focuses on China's FDI and international trade, as well as regional development of Asia. And finally, if there is time, Dr. Sarah Tong will also present. You've seen her in the first panel of the conference. She's senior research fellow at EAI. She received her PhD in economics from University of California, San Diego, and her research interests are on recent development and transformation of the Chinese economy. Let me open by turning the floor over to Xuejin, Professor Zuo.
Okay, thank you very much. Hi, good morning, everybody. Can you hear me?
Yes.
Okay, I'm Xuejin Zuo from the Shanghai Academy of Social Sciences. Thank you very much, Christine. I'm going to speak on China's population aging, long-term trend, and the socioeconomic impacts. Okay, next slide, please. Okay, I think in recent years, people found that China's population is aging faster than originally earlier projected, especially after 2013 and 2015, the policy changes to relax fertility control. But still, the response from the such policy changes are very moderate and short time. Next. Okay, the research team from the Shanghai Academy of Social Sciences, we made a new population projection based on the newly available, population data in China, including the birth and the total size of the population annually, reported by the National Bureau of Statistics. So we use such projections to project population, China's population from 2019 up through 2100. Next, please. Okay, we use three variants, the high variance, the median, and the low variance. The total fertility assumption is for the median variant, we assume the total fertility will decline from about 1.5 in 2020 to 1.4 in 2030, then gradually increase to 1.6 in 2080, then remain at such level until the end of the century, 2100. And for the higher variance, we assume that the fertility will increase from 1.4 in 2020 to 2.1 in 2080 and remain at that level through the end of the century. And for low variance, we assume the fertility will decline from 1.5 to 1.1, then remain at this in 2030, then remain at that level up to 2100. Why 1.1? Because some Chinese population, like the Taiwan, Hong Kong, in China, and and some other Asian countries like Singapore, Korea are around 1.1 or even lower. So we assume that it's possible that the lowest version is possibility is 1.1. Next, please. Okay, so if we look at the population size, we can see the for the median variant, the population will be around 800 million. Okay, roughly speaking, 800, and for low variant, it will be less than 300 million, and for the high variant, it's 1.1 billion. Next. Okay, so the peak of the population size will be around 1.4 billion for the three variants around 2029, 2026, and 2023. So it's very likely that in the next 5-year plan, China's population will reach its peak and begin to decline. So by the end of this century, it's going to be around 1.1 billion and around 800 million and below 600 million. Next, please. In the same time, the elderly population, 65 and older, will increase dramatically before about 2060. So it's I think it's about 120 million to about 450 million by around 2060, then started to decline. Next, please. Okay, skip. Okay, next, please. Okay, the proportion of the elderly in the total population will increase basically very fast between 2020 to 2060. By the end of this century, it will be around 30% for the high variant, around more than 40% for the medium variant, and over 50% for the low variant of the projection. Next, please. And the population will be very, very old. The older elderly, 80 and over, will be over 50% of the total elderly. Next. And the working age population will be decline, continually, throughout this century, from current less than 1 billion to about 200 billion for the low range, and maybe 400 something billion, a million for the medium range, and higher for the higher range. Next. And the working age population currently this is the past. Okay, the working age population will increase from the about 2/3 of the total population in early 1990s to the peak in 2020, then decline to it's about 3/4, then to just over 70% in 2019, and I think the process will continue throughout the next 40 years of this century. Next. This is the wage rate. Okay, we can see the China's wage rate in manufacturing sector increased dramatically from 1990 to 2019, from about 1,000 yuan yuan per year to nearly 80,000 yen per year. So it's very fast. Next. Okay, this is a growth rate of average wage rate. The red line is the growth rate of the Chinese wages, and the blue line is the growth rate of Asian wages. We can see for the next for the past 2 decades, Chinese growth rate is always higher. Next. Okay, this is the trade dependence in China. That means the total volume of export and import as percent of total as percent of GDP. We can see in the in earlier this century, about 2006, it's nearly 65%. Then it's declined to just over 30% in recent years, and it is possible that it will continue to decline. Next. In the same time, the saving rate has begun to decline too. Because once you have an older population, the older population, they have more consumption than labor income, so they tend to be dissavers in the economy. So when you have population aging, then you have a lower saving rate. We can see this in Japan, and we can see this in China in recent years too. Next. Okay, this is the dependency ratio. This is a ratio of young child population 0 to 14. The ratio of child population to the working age population is around just over 20%, and for the old dependency ratio, that's the ratio of elderly population to the working age population. It's we can see this dramatic increase by 2060. And this is the total dependency ratio. It's going to be increased from over 40% to over 90%, and further to over 100% in this century. I think most increase occurred in the next 40 years. So this is very, very challenging to China's socio-economic development. Next. Okay, skip this, please. And this is this is saving rate. I think we show saving rate already. Is this? Okay, next, please. Okay, this is the investment rate. That means total investment, percentage of total investment in GDP. We can see it's always, again, it's peaked around 2010, then start to decline. Okay, we can see in recent years, investment remain very high, but we anticipate it will further, decline in future in next, 2-3 decades. Next. Okay, technological progress. What's the impact of population on technological progress. I think this is also the topic discussed at this conference. I think maybe it's more complicated because from the supply side, in the perspective of supply side, because the inventors, the creators tend to be young. Many empirical studies found the average age of most productive age is around, in science and technology, is around 40 years old. So when you have a very old, working age population, from the supply side, I think it has some negative impact on innovation, being invention and innovation. But on the other hand, population aging will increase demand for substitution of labor by new technology, and the demand, when there is stronger demand for bioscience and healthcare, etc. So that will motivate R&D and investment in these fields. So I think we need more. In China, we also have debates on this. So I think we need more empirical evidence on this, especially in a very large population like China. Next, please. Next, please. Consumption. We can see, the consumption as percent of GDP increased in recent years. Again, the turning point is around 2010. Next, please. But on the other hand, we can see, although the proportion of consumption in total GDP increased a little bit, but the growth rate of consumption, as indicated by total volume, social retail, okay? The growth rate declined. I think this is related to the slower growth of GDP in recent years too. Next, please. Okay, the other thing is, if you want to investigate the impact of population aging on consumption, we have to pay attention to the impact on different sectors in the economy. Because for some sectors, they have very significant profile of consumption by age profile of consumption. I think we did something to try to okay, I think I have to stop very soon. Okay, this is the age profile of consumption. It's very difficult to collect the data because this is the data for education. I think for education, most expenditures, including public and the household expenditures, concentrate in the earlier stage of life. From maybe 6 through early 20s. Next. Okay, this is healthcare. I think in contrast, mostly healthcare in life cycle, most healthcare expenditure spent on the later stage of lives. Okay, this is private and public and the total. Next. So we did the CG model. Okay, next, please. Because time, I just say some results. Okay, we use a CG model based on China Gem. It's developed by Professor Dixon at the Center for Policy Studies, Victoria University, Australia. But we make some changes to this model. Next. I think I skip this one. Okay, I just show some results. Next, please. Okay, one group of exercise we did is to investigate the aging. If we include the aging of profile of consumption in the model to compare with the situation without such consideration. Next, please. Next, please. Next, please. Okay. We can see this. Okay, I cannot see other things. I think the first group simulation is to compare when we. This is without including the age profile. We see with population aging, all the factor input and the GDP growth will decline from I think 6 gradually to just over 2%. Next. Next, please. And we can see that the pension will accumulate a huge debt. At the end of this century, it's over 260% of GDP. Next. And okay, this is, we compare the two situations. One is to include the age profile of consumption in the model, and to see the deviation from the baseline situation, which does not include the age profile of consumption. We can see because the availability of data problem, we include only 4 sectors, which is I think this is education, this is healthcare, and maybe social work and social work and the family family care or something. We can see education will decline, and the healthcare will increase, and the social work and household care will increase too. Yeah, yeah. Next, please. But I'm okay. The other thing is we investigate what happened if the population growth rate is higher or lower to compare with the median. Okay, the high median, the high variant, low variant to compare with the median variant. Median variant is the baseline. Okay, next, please. Okay, the deviation, this is the high variant, S2.1, to compare with the baseline, median variant. We can see if we have a higher population growth, most economic indicators will be improved, like capital input, total employment, and the real GDP, and the real. But only indicator will decline is the real wage rate. Real wage rate will be lower if we have a more higher population growth rate. Next. Okay, this is investment, household consumption, and government demand, import and export, all will be higher. Next. Okay, skip this, please. This. Okay, this is the pension balance. I think we will improve the balance of pension if we have higher population growth. Next. And the government deficit too. The government deficit will be the burden will be lighter if we have higher population growth. Next. But if we have lower population growth, that's S 2.2, low rent, then everything will be reversed. Next, please. I'm afraid I have to stop here because my time is over. So I think the policy suggestions is that we have to make better use of labor resources to improve the labor market and etc. I'm afraid I have to stop here. Thank you very much.
Thank you very much, Xuejin, for a very interesting presentation. Your model looks very valuable, and I hope that we can have time in Q&A to talk about some of the findings in greater detail. It's too bad we don't have enough time now. But I remember already in the 1990s, you started talking about how China needed to change its population policy and loosen family planning controls to avoid this kind of disastrous scenario that you've been outlining. So let's move quickly on to Dr. Glinskaya for her presentation. Elena, please.
Thank you very much. Thank you. I'm going to take us from a very macro presentation based on census data to something which is much smaller and concerns options for financing elderly care in China. And I'm going to talk about particular line of financing, which is long-term care insurance. And I'm going to talk about the pilots that's been implemented in China already. This is drawing on the work with Zhang Feng from the Research Triangle Institute and also with some of the other colleagues from the World Bank. Next slide, please. I'm going to start with presenting the general framework for elderly care in China, and I'm not going to spend a lot of time. This is panel number 7. I'm sure that you've heard enough about the general framework, but I just say a couple of words. And then I'm going to talk about one particular reform direction in public financing, which is long-term care insurance pilots. I'm going to focus on phase 1 because I don't think that we know enough about the phase 2 pilots to say much. They just started, but also nevertheless, it's a very interesting development. Next slide, please. So talking about the general framework for aging and elderly care in particular, I think what's important to acknowledge is that China actually started formulating strategic plans quite long time ago. And as society continued aging, China formulated more and more detailed plans for dealing with the population aging, and this graph presents some of the milestone legislature. Next graph, please. So in terms of policy framework that emerged from this legal work, it's pretty stable. It's pretty stable. What we have in China is the reliance on the home-based care as a bedrock, supported by community care and only supplemented by institutional care, while at the same time coordinated with health care. Another important tenet of elderly care framework is that private provision and private self-payment play the main role in elderly care system, and that the delivery is based on diverse models, all working with the private sector. There's been shift in policy focus in early 2000, and it actually continues a little bit. And the shift is from institutions to home-based care, from inputs to outputs and care provision, from fragmented system to continuum of care, and from learning and experimentation to system innovation. So this pilots in long-term care insurance fall into these new policy directions where the government, the national government incentivizes the provincial governments to search for models to increase access and improve quality, and what kind of financing could underpin these models. Next slide, please. The next, I will skip this one. Next slide, please. The landscape that emerged from this policy and the framework is quite diverse. I'm not going to go and discuss sort of every point on this graph. The only point which I want to make here is that it's a diverse system that at the low end, at the medium end, and at the high end, and also in terms of the intensity of care provision, intensity of nursing care, there is something or the other in the market in that particular segment, and that's quite remarkable, given that China started this process not that long time ago in terms of how much time usually countries take to develop these complex systems. Next slide, please. So what kind of financing underpins this diverse system? Well, in terms of where the money comes from, it's out-of-pocket payments which dominate payment for the services. In terms of the public financing, the bulk comes from the Public Welfare Lottery Fund. And according to the MOCA estimates, about 60% of the total amount, and this is a little bit of a detective work, right, that we had to do, and it's based on some earlier work to come up with these estimates. About 60% is from the Public Welfare Lottery, about quarter from the local governments, and there are some other sources that also provide funding for elderly care. Again, detective work, some estimations, it's about 0.04% of GDP. It's not a lot, but if you think about sort of absolute numbers, it's not trivial. So it's not a lot in relative terms, but in absolute terms, it's quite a substantial amount of money. So in terms of how the money are spent, what the government does, it allocates funding to cover services for selected vulnerable groups, and it used to be sort of free nose and WUBAOs, but increasingly there is greater emphasis on the level of functional impairment. So it's not just based on the vulnerability status. Importantly, government also provides capital subsidies for both public and somewhat private run facilities, and there are operating subsidies for privately run facilities as well. Local governments provide some either cash or vouchers, some local governments, to eligible population. Usually it's persons over 80 or sort of frailty defined in some other way. Next slide, please. So that was a background, and now I'm going to talk more about the long-term care insurance pilots per se. I want to start by mentioning that long-term care insurance pilots are part of the stream of national pilots to test various aspects of IHK models, and there have been quite a few of them. The phase one started in 2006, and it was started by the Ministry of Health, Ministry of Human Resources and Social Security, of course. Important development that happened between then and now is the establishment of the National Health Services Security Agency and the shift, the transfer of the LTCI functions to this new agency. We can talk about this during Q&A if there is interest. Next slide, please. So now more about the LTCI pilots. So as I already mentioned, it was Ministry of Human Resources and Social Security that issued guiding opinions, and 15 cities from 14 provinces have been selected as the pilot sites. The main tasks of this pilot is to try out different scope of coverage, premium contributions, benefit design, needs assessment, classification, certification for eligibility determination, protocols for contractual management, reimbursement methods. So trying out different building blocks for any social insurance system. Next slide, please. Next slide, please. Thank you. This is actually the attempt to depict the pilot sites on the map. I don't know that we didn't do a very good job because they are not sort of well, you cannot see them well, but we tried. These are black circles. You see that they're clustering on the coast, but at the same time, yeah, there are circles pretty much across China. So they were quite balanced in terms of geographical coverage, but somewhat. Next slide, please. I also want to spend a few minutes talking about the research methods of this study. What we've done is we tried to summarize the pilot. We tried to put together a narrative. So we couldn't do evaluation because there's just not enough data to rigorously evaluate the pilot, and I'll be talking more about this. So what I'm presenting is a narrative, is a description of these pilots as they were implemented. We've sieved through central government and local government websites. We sieved through research articles and grey literature. We actually grateful to the School of Public Health, Peking University, which made available to us the database with 172 officially issued policy documents. And we are also very grateful to the China WHO biennial collaborative project. They made available to us the case study on long-term care insurance schemes for the elderly in Qingdao. So this is also a very important source for us as we put together this narrative. Next slide, please. So I'm going to talk about findings, and I'll sort of try to go a little bit faster here. So target population of the insured. 8 pilot sites covered urban employee basic medical insurance and release, right, which is quite consistent with how the other insurances have developed in China. And I mean health insurance and old age insurance. 2 cities covered urban employees and urban residents, but 5 cities found it possible to be most inclusive in their coverage and to cover urban employees, urban residents, and basic medical insurance in release. In terms of financing mechanism, again, we looked at the numbers. Most of the LTCI funds came from the urban employee medical insurance funds, pooled funds. It just uses that's what happened. 2 pilot sites required some employer contributions. And what we see also that if cities extended coverage to people outside of the urban employee scheme, they've had more diverse type of financing coming into the LTCI. In terms of operation characteristics, as I already mentioned, it's Ministry of Human Resources and Social Securities and the local bureaus. They took the lead in designing, implementing, and managing in pilot city. And of course, they collaborated with the bureaus of civil affairs, health, finance, and others. Of course, it's going to change soon, and it's actually changing. And the Municipal Bureau of Healthcare Security Administration are now managing LTCI implementation. We don't know much about this, and this is something which I think is very important as the future research topic to understand how this shift impacted the implementation. Next slide, please. In terms of eligibility for benefits, well, pretty much all sites defined eligibility as person needs to be insured and then have severe disability due to age, illness, or injury for at least 6 months. Also importantly, all pilot cities either designated government agency or hired third-party evaluator to conduct disability and needs assessment. So that became quite formal, which is very important. 2 cities extended eligibility criteria to moderate, mild disability, and everyone else defined it as only severe disability as eligibility for receiving benefits. Majority of cities used Barthel scale, but Shanghai and Chengdu developed their own evaluation tools. I have to mention that Shanghai's uniform standard for elderly care needs assessment is really sort of the best international practice. So it's best international practice and local practice combined together. It's really a very interesting tool, very good going forward to have something like that could be extended to other places in China. Next slide, please. Benefit package design. So the Ministry of Human Resources and Social Security allowed for 3 types of care to be covered: home care, designated residential facilities or nursing homes, and designated medical facilities. And what we see that most pilot cities provided at least 2 of these services. In Shanghai, again, LTCI covered quite a diverse range of services. So there was visiting home, community care, nursing home care. Also, importantly, Shanghai often offered options to receive either cash or service. So beneficiaries could choose what they want to select, in-kind services or cash. Reimbursement rates varied, and in most cases, LTCI just covered 70% of the costs, and there were payment ceilings in most of the places. Next slide, please. In terms of the number of beneficiaries, Shanghai covered almost 200,000, almost, but not quite. And this data is as of February 2019. Qingdao, which initiated LTCI pilot way before other cities in China, served 60,000 clients by April 2019. The large cities had a number of beneficiaries in tens of thousands, and the small cities had the number of beneficiaries in the single digit of thousands. What's important is that the LTCI beneficiary numbers were slightly lower than the number of applicants. Well, partly because not everyone was qualified, but also because disability process took quite some time, and just many of the prospective beneficiaries just did not survive long. That sort of tells you that people who applied were in quite fragile state when they applied for LTCI benefits. Next slide, please. So I'm going to talk about some observations that we can draw from this narrative. So prioritizing the coverage for urban workers medical scheme is consistent with the way China rolled out the previous two types of insurances, the medical insurance and the old age insurance, the pension insurance. But at the same time, you know, it's understandable that if you continue on this path, you'll prolong existing inequalities. So while it's okay to start like this, sort of thoughts need to be put into, you know, how exactly these existing inequalities would be eliminated. Heavy reliance on the urban employees funds, medical insurance funds, is also potentially problematic because the health insurance in China is still quite shallow. So, you know, taking money away without requiring regular contributions from the individuals or perhaps even from employer is not going to be conducive for the fiscal sustainability of this insurance scheme. So again, something that in the future will have to change. Likewise, locally pooled funds are probably not going to work in the long run just because it is just going to be difficult to establish a sustainable social insurance system without the financial support from the central government. Next slide, please. The eligibility criteria are quite stringent, and again, sort of, it's probably okay to start like this, but to keep it at such a stringent level would mean that many prospective beneficiaries will not be able to receive services. They will not be served. Only people at the end of life will be served. Again, you know, with time that needs to be looked at. The substantial variation across pilot city, again, I'm coming back to this issue of creating regional disparities. Okay for the piloting, but as this going forward, perhaps some thought needs to be put on how to go forward without creating the regional disparities. Similar consideration in terms of the generosity of the benefits. Again, fine to start low, but probably a desirable policy goal is to gradually increase not only the number of beneficiaries but also the diversity of the package of the coverage in terms of what services are provided. Of course, at the same time, trying to keep the LTCI solvent. And last but not least, we still know very little. I'm not aware of many evaluations of pilots. We need data to evaluate these pilots, right? So there's still so much work to be done to understand what the phase 1 pilots have been able to accomplish, and the phase 2 pilots are already going on in 29 cities. This is a very good development, but what our plea is to accompany them, the rollout of these pilots with the robust data collection, so we can understand what exactly these pilots are accomplishing and how they impact their beneficiaries. Thank you very much, and let me stop at this point. Thank you.
Thank you, Elena. That was really fascinating. Very, very, very interesting. I think I wish your presentation had come a little earlier in our conference, because many speakers had talked about how countries are not prepared for aging, for dealing with an aging population. It sounds like China started some time ago to prepare for this contingency. And I hope that we can have time in the Q&A to discuss, how substantive the preparations were and what difference it's making in terms of aged care now. I found actually your mention of tapping the unemployment, the other social security funds to subsidize the LTCI benefits very interesting, because this is one of the ways government is now tapping government funds beyond the budget to pay for fiscal expenditures. So I hope we have time to talk about that also. Turning now, and thank you for keeping more or less to your time allotment. And I hope the next speaker will do the same. Let me turn over to Yao.
Okay, thank you, Professor Wang. Yeah, I will try to be fast. So so Dr. Teng and I will present some of our preliminary findings for this study, co-authored with Jing Yichuan, a very smart young lady. So basically, our study is about the economics of aging in Asia. It's a literature review based on the data of literature from recorded by the Web of Science. Next slide, please. So our presentation will cover these 5 parts. I will mainly present the first 4 parts, and Dr. Tong will talk more about the future study. Next slide, please. So first, some of the background information. This is from the UN website. So it's the percentage of population aged 65 or above for continental data. So from this picture, we have 2 parts. The white part is the real numbers, and the parts in the gray area are the projections. From these parts, we can see that European is the continent that with the highest rate of percentage of aged population, and it's also the earliest continent. And then we also find that the green one, Latin American and the Caribbean area, these parts actually it's predicted by UN that it's going to chase up the European level. And actually for recent decades, actually since Second World War, this area, their aging issue, actually the trends are very close to Asian areas, which is the red line. Okay, and also we can see in the middle of this chart, we have a horizontal red line, which mark the period that when European countries started their aging process, which is around 1990s. So next slide, please. So for these slides, we come to the some of our selected Asian economies. Although in previous slides we can see that it seems like the aging issue is not that serious for the whole Asia. But when we come to these selected countries like or economies like China, Hong Kong, Taiwan, Japan, and including the Singapore, we will see that comparing to European and comparing to LAC, Latin America and the Caribbean, still the blue line and the green line. Okay, we can see that most of our selected Asian countries, they will soon have higher percentage of aged population, and also some of the country actually this process are much faster than the European. From previous previous picture, we can see that for European, this process lasted for about 50 years, but for China, or for Korea, we can see that it's less than 30 years. Next slide, please. Okay, so this picture, we changed our variables. It's the per capita GDP of our selected economies. Again, the benchmark, we select the Austria and Germany. These two economies have the highest percentage of aged population in Europe. We are trying to compare their per capita GDP when they studied the aging process, which is around 1990s. So we can see from this figure that except the Japan, Hong Kong, and Singapore, actually all other of our selected Asian countries, their GDP per capita are lower than Austria and Germany when they start the aging process. Next, please. So based on the background information, we can see that there are some features of the aging process for the Asian economies. First, the speed is faster than other economies or regions. Second, because of the huge population like China, so the number of aging population and the percentage of aging population are much higher than other region or economies. And the third one is that all our selected, most of our selected economy, they are facing this aging while still underdeveloped problem. I remember in the panel yesterday, some speakers also, actually several speakers also mentioned this issue, and actually this is true. So next slide, please. So our research questions for this study is that, what do we know about Asia's aging-related issue from economics perspective, and what can we learn from other regions on aging-related economic studies? Next, please. So our data, as I mentioned earlier, is based on the literature data from the Web of Science. It covers 549,000. It's a lot of literature with aging related keywords. So for these keywords, basically we include 4 aspects of the keywords, like the demographic related, like the demographic transition, demographic change, age structure. And the second category is the aging related, like the population aging, global aging. So at the beginning we just use aging, but we find that for aging issue, actually the wine aging was also included. So we have to use these more detailed keywords. And then the third category is the elderly related, like old adult, old population, old society. And last category is the pension and retirement related, like the pension plan, retirement system, something like this. So based on these keywords, we have these more than 500,000 literature related to aging study, human aging. Okay, and then also we covered literature under the category of we call it economics, but actually it includes the economics and the business related studies. And then we can see it's more than almost 2 million literatures. And then when we combine the keywords of aging and the economic categories, then the number of literature turned down to the more than 21,000. So these are the key data we used. And then the period covers is from the January of 1920 to September of 2020. All this literature, we find that it covers 81 countries or regions. And the methodology, major methodology actually is that we use the author reference and the keywords analysis by the software site space. Next, please. So here is some big picture. We call it big pictures based on the whole data set. We can see that in terms of number of publications, the dark red ones, the dark red areas are the economies that with most publications in aging area. So it's basically USA. And then China, Australia, and Canada also have lots of study related to aging issue. But this is just based on the absolute number. When we next slide, please. Okay, so when we check the share of aging-related economic studies in the overall aging studies, we find that, again, the dark red areas are the areas with highest share. So we can see some of the European country, actually, they have the highest share, which means that for researchers who are interested in aging topic, European researchers in European countries or economies, there are more people interested in the economic aspects. Okay, next slide, please. So for these slides, it shows the share of aging-related economic studies over all economic studies. And actually, to our surprise, we find that some of the Latin American economies and some of the Eastern European countries and some of the African countries, actually, they also have high share of relatively high share of economists interested in this aging problem. I think we still need further study on this, but based on our knowledge about these areas, their study related to aging issue must have some of their special features, like the transition economy or low income economy or economies with serious inequalities. Of course, the economies which start their aging process earlier, like Western European country and Japan, they also have more share of economists interest in this aging study. Okay, next slide, please. So here, this curve, this chart, actually, we show the evolution of aging-related studies. So it's overall aging studies, including both the economic-related or other areas. The blue line is the share of econ studies in the overall aging studies. We can see that this share decreased after the Second World War, 1950s, and then start to increase again since 1990s. I think the decrease is just because there are more researchers in other fields started to pay attention to this issue. Next slide, please. So when we zoom in, the charts of previous slides, we can see that during the period of 1950 to 1990, the blue line, the share of econ studies in aging related research actually decreasing. Yeah, next slide, please. But start from 2000, actually 2004, we can see there's an increase of the aging-related econ study in the whole aging studies. Next slide, please. So here we go deeper to the specific fields of aging-related studies. We find that actually most of the, so here we list the top fields by decades. Okay, by decades, with the first two columns for the most recent studies. So we can see that actually most of the top fields are actually health related or technology related. For the and also we notice that the share of top fields have decreased. For example, for the second row, the gerontology, this field, the share decreased from more than 15 to recently only 6.5. And there are several other fields we can also see these trends. So this indicates actually for the overall aging studies, actually the fields are more diversified now. And then we also notice that if we only focus on the pure economics study, which is categorized by the Web of Science, we will see that the share or the rank are actually not very high, or after 10, the rank after 10. But if we include like business related or management related fields, then we will see that actually there the rank of economic studies is higher. From later analysis, we'll see that actually, like the study just presented by Dr. Glinskaya just now, actually it may be categorized as financial study, not the economic study by the Web of Science. Okay. Yeah. Okay. Next slide, please. So here we just focus on the aging-related economics studies in this table, and we find that even though we, when we download this data, we have defined that it must be under the category of either economics or business finance or management of business. But still, there are some studies or literature categorized as other fields like health policy services, healthcare science services, which we highlighted in red, and also psychology applied and environmental studies. So this indicates that actually the aging-related economic studies are now more multidisciplinary. So it's not just pure economic or management studies. People also combine their research with other fields. Next, please. Oh, okay. Wow. So next slide, please. Oh yeah. So here, now we also did the network analysis with site-space by the keywords and the reference. So we have 5 different periods. Next slide, please. So for the first period is between 1970 and 1989, which is the first period that we have clear clusters. So basically for this period, studies focus on the decision maker retirement policies and also economic consequence, pension, augmented balance sheet. So these are in this period, researchers are still trying to recognize, define, or understand the issue. Next slide, please. Okay. Okay. Sorry, I have to stop here.
Are you finished? Okay.
No.
Thank you. Sarah, I'm not going to call on you because we only have 15 minutes now for discussion. With apologies to you. Okay, so we have a few questions on the table already. The first one is from Dr. Kong Tuanyuan, my colleague. This is for Professor Zuo. Could you elaborate why the policy change in 2013 and 2015 are less effective? And did your projection on fertility rates of Chinese women consider these policy changes? Maybe so. That's the question for Professor Zuo, and then we have several questions for Dr. Glinskaya. So, do you want to go first, Xuejin, and try to keep the answer short so we can get in a few more questions? Thank you.
Okay. Can I answer right now?
Yes.
Okay. So in 2013, the central government decided to allow either the husband or the wife from Wencha family to have 2 children. That's called 单独 how to say it? Okay, 单独二孩. That means either the wife or the husband from Wencha family, they can have 2 children. And in 2015, to have 2 children for every Chinese families, unconditional. So because the decision was made in 2013 and 15, and it's effective in 2014 and 16. So we see the fertility increased from 2014 to 2016 a little bit. But since 2017, the total birth declined again. Okay, so it's less effective than people expected earlier. I think one problem is we have the second parity of fertility very high, over 50%. That means some people they have the opportunity to give to have the second child if they want after the relax of the policy. But the problem is that the fertility for the first child, the first parity is still very low. So in future, I think we are going to see the further decline of the fertility in the next, maybe several years. So because this is determined by the socio-economic changes rather than the policies. That's many people's judgment, including me. Okay. Did I answer the question?
Yes, I think so. Thank you.
Okay.
Next questions are for Dr. Glinskaya. One of them is from Bert Hoffman, my director. And since he's here on camera, I will let him ask the question himself. This is a question I'd like to ask. So please go ahead. Please go ahead. Okay. Bert, we can't hear you.
Okay, let me try again. Can you hear me?
Try again.
Yeah, I'm trying, but can you hear me?
Yes.
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 All right. Okay, so the question is a simple one. The question is long-term care insurance at all a good idea for China or for anywhere else in the world? And for China in particular, because I recall the very long discussions on pension in the 90s, and in the end, the decision was to have a mixed system with a public pillar and then an insurance pillar and then a private pillar. And frankly, we're 30 years further and the pension system is in bad shape. So does an insurance system help for long-term care beyond what you would get from a publicly funded minimum system for vulnerable people? Thanks.
Go ahead, Elena. I think you can go ahead and answer.
It's a very tough question. Look, focusing on the poor only is not going to allow the market to develop. So first of all, one need a market, right? So anyone who wants to purchase services would need to be able to purchase them, right? So the case of missing market is a huge welfare loss, right? So without the government support, this market will not develop, right? So how the government wants to support the development of this market, that's an open question. The conventional wisdom is that trying to do it through budget is not necessarily an optimal way, because again, variety of reasons, because of the time inconsistency, and that doesn't then have the proper incentives for behavior and so on and so forth. So providing the minimum only is not difficult, but it doesn't really serve the purpose. It doesn't serve the purpose of making the availability much broader. So we kind of left with the social insurance as the only instrument that can provide this broad financing for this market development. Now, it doesn't have to be payroll. It doesn't have to be financed from payroll tax. That's a very good point, right? But it still has to have the features of the social insurance, where people pay and then they pool the funds, and then when the catastrophic event happens to sort of somebody in the pool, then the payments are made. So you still need these features in terms of the payment, while where the money comes from, that's in my view is more flexible. I don't know if I answered the question.
Well, maybe this is related to the other questions that have been raised. One again from Wong on the long-term care. Do you find any criteria for selecting the pilot cities in the guiding opinions? He says, I'm just curious why some big cities, such as Wuhan and Xi'an, are not in the pool. And second, it seems every pilot city have their own financial mechanism and assessment tool. So is there any assessment or KPI from central government to evaluate which one should be promoted nationwide?
On the selection of cities, no insights. They are what they are. I mean, I understand why some of the cities been selected, Qingdao, Shanghai. I mean, those sort of sensible choices, of course, because they've started much earlier, even before 2016. Why the others were chosen, I can't answer this question. In terms of in terms of the disability, you asked about the questions about disability evaluation, right?
Yes, it's the assessment. I suppose that's what it.
The assessment, right. It's a good idea to allow southern flowers bloom, but it also a necessity because the funding is still local, right? I mean, China is the one who pays, the one decides what covers is not. So it would be very difficult for the national authorities to mandate a particular assessment tool. So if I were to sort of try to forecast, I would think that sort of the good practices will be summarized and they would make their way into the national level guidance. It will probably take some time and, not clear how exactly this process is going to go, but it's quite a sensible approach to allow local innovations and then try to summarize them and sort of use them in more distilled form for the national level guidance.
Is there some financial incentive attached so that, for example, the lottery funds are divided 50-50 between central and local governments? And so if you join a pilot, does the city then capture some of the central portion of the lottery funds? And that would be an incentive for getting on the wagon first to get a bigger share of the pot.
The scheme for dividing the lottery funds is quite opaque. My sort of what we've been able to decipher, it's 50-50 between national and provincial, and then within the province there is also a scheme of sort of dividing it across the sort of local level. So that's how it's typically done. Everything else, exactly. But in terms of using lottery funds for the central schemes, to the best of my knowledge, it's not used to incentivize participation in the pilots. It's still only used for transfers into the sort of the poor provinces and so on and so forth. That's actually an area where the World Bank is very interested to work with the government to help, develop a system to incentivize provinces to experiment and also to collect data and sort of share data or from this experimentation for evaluation.
Okay, we have 2 minutes left, and we have two questions still on the board. One is also for Professor Glinskaya from Stephen Lackey. The chart on types of aging care represents most models for advanced developing and developed countries. How does China compare to actual delivery of services versus the developed countries?
Of course, it's different, but China is leapfrogging many of the issues that more advanced countries are grappling with. One of these, I'll give it one example: bringing in private sector participation for the delivery of aged care services. In many of the developed countries, many more advanced countries, they're not necessarily advanced, it's just countries which aged earlier. systems of the public provision been much more entrenched, and when the sort of the funding became more and more scarce, it was much more difficult to switch. And in China, sort of private sector is participating, quite enthusiastically. But again, I mean, it depends on the model. It depends on the segment of the care. And I'm not saying that there is something wrong with the public provision. It's just very expensive. Public provision is wonderful if you can afford it, but sort of most countries can. So this transition from public to private in many countries, is quite painful. While in China, as I said, the leapfrogging might be progressing easily. And one point which I absolutely have to mention is the technology. I think we haven't seen the full extent of this, but the assistive devices, the bringing in of the technology into the care provision in China is going to take off, in leaps and bounds. When I sort of lived in Beijing, when I met with my clients, I was saying that, look, we don't know how it's going to work in 5 years. If I were to sort of try to forecast, I would say that drones will bring, things for the elderly in remote areas, because that would be the most cost-effective way of doing this. So there are. There is a lot of the point which I want to emphasize here is there is a lot of depth in types of provision that are being tried out in China, and there are also opportunities for leapfrogging, and especially in the areas of technology.
Okay, thank you. Brett Hoffman wants to come in to both answer some of the questions, but he probably has a final word to say about the conference.
I have a final word for the conference. First, thank you very much for the panelists and the chair for this interesting expose. Second, as Liao's presentation showed, there's a tremendous amount of literature on aging, but at the same time, I think this conference has told us that there's a tremendous amount to be done. And this is a very dynamic field, clearly a very multidisciplinary field, as the conference has reflected, with angles from indeed gerontologists, from technology, from economics, and of course the public policy angle is very, very topical in China, because in China a lot is still unsettled and a lot is still malleable. I do believe that even in terms of the economics and the projections of the economics, the times are changing, and that is in part because of technology, but also because there's a very different thinking about how one can productively use elderly people in the economy, and there's lessons from Western economies that are ahead, but there will increasingly be lessons from China that will be useful for other countries as well. So I think this is a very productive and interesting area of study, and I hope that my colleagues in the East Asian Institute will continue to partner with some of the representatives in the various panels of this conference to push this forward. And we're happy to take sponsorship from the World Bank, and Elena can take that message to Washington. But no, without kidding, I would like to thank every speaker and every panelist of the conference. This was great, and I really appreciate your contribution. I know that at some point it was for some people we held panels at impossible times, and yet people were very happy to join. So I also think that shows how attractive the topic still is. I'd like to thank our partners from the China Academy of Social Sciences and the Institute of Social Development, and the Department of Sociology of the University of Tsinghua for organizing this. And once again, I'd like to thank the key organizers from our side, Zhao Li Tao, Sarah Tong, James Tan, and I would also like to give a compliment to Kumar, our technology contractor, who has been probably the most interactive with all of the speakers, and has been in the background, but doing very essential work. So with that, I would like to close the conference, and I do hope that we'll have a follow-up in many senses, and that we have add to the 598,000 papers that are already there on aging in the coming years. Thank you very much.
Thank you.
Okay, thank you.
Thank you.